Logo for the National Center for Advancing Translational Sciences, NCATS. Slide title: Revealing Undetected COVID-19 Spread, How NIH Researchers Teamed Up on a New Study. Filmed Summer 2020. Matthew Hall, PhD, Acting Director, Early Translation Branch at NCATS, speaks into the camera.
One of the things that had become clear to me was that, and to my colleagues, was that understanding the way this virus spreads through the community was going to be really important. And one way to do that is with a seroprevalence study or a serosurvey, where you take the blood serum from individual donors and you test it to find out whether they have antibodies that show immunity towards the SARS-CoV-2 virus. So we started to sort of pull together these core team members. Within days of us connecting, we'd already designed a clinical study.
Slide title: Designing a Study for Collaboration and Social Distancing. Matthew Mamoli, MD, MS, Director, Laboratory of Infectious Diseases Clinical Studies Unit at the National Institute of Allergy and Infectious Diseases, NIAID, speaks into the camera.
This study was designed to achieve our goals very rapidly in the middle of social distancing. And so we designed methods in which to sample people at home using microsamplers. And we also used technological resources to allow us to consent participants, as well as identify appropriate participants that are representative of the various demographics throughout our country. And this requires a big collaboration between multiple institutes here at NIH.
Logo for NCATS, logo for NIAID, logo for National Institute of Biomedical Imaging and Bioengineering, NIBIB, logo for National Cancer Institute, NCI at Frederick.
Including scientists, epidemiologists, statisticians, individuals with expertise in participant selection, and of course, careful laboratory scientists in order to do this study.
Slide title: Choosing the Right Test. Caitlin Sattler, PhD, Chief of the Section of Immunoengineering at NIBIB, speaks into the camera.
We wanted to use something that multiple labs could repeat. So we focused on using an ELISA.
Image of ELISA.
Because it's a very simple assay that can be repeated in a variety of resource settings. And since it's a global pandemic, we really want to use assays that can be repeated and can be utilized in multiple countries across the planet. And we're able to collaborate with scientists in different fields, such as robotics and automation, to make sure that our high number of samples gets processed quickly, efficiently, and then also cleanly, so we have no technical worries about the analysis.
Carlene Klump-Thomas, MS, Lead of the Research Services Core and Automation, Information Technology Resources Branch at NCATS, speaks into the camera.
The process of assay development and optimization is one that we do at NCATS on a regular basis. My role in this project has been to bring automation to a process that was being done manually on the benchtop to allow for more efficiency and increase the throughput.
Slide title: Expanding Enrollment Reflecting Diversity. Claire Schmidt, PhD, Deputy Director of the Division of Clinical Innovation at NCATS, speaks into the camera. Logo for the Clinical and Translational Science Awards Program, CTSA.
We've had two CTSAs involved in this study, the University of Pittsburgh and the University of Alabama. They've been instrumental in contacting volunteers, because on the first weekend after announcing this NIAID study, there were over 400,000 volunteers that contacted NIAID. The two CTSAs have contacted all of those individuals, and when they contact them, they ask specific questions. For example, have you had symptoms of COVID-19? The other thing that has been really critical is that the CTSAs also ask demographic questions. In this way, we can get a very diverse cross-section of the US, different communities, different populations.
Slide title: Tracking Progress with a Data Dashboard. Andrew Kelly, MBA, Budget Officer at NCATS, speaks into the camera. Map of the United States showing color-coded dots related to enrollment.
The dashboard is important to the research because it helps us to see who's enrolling and to be able to fine-tune that enrollment as best as possible to reflect the country. So I work in the budget office, which is not normally a part of the science team, but ultimately we had a tool that we were using every day for administrative functions, and so we were able to quickly repurpose that so that when the team came to us with the data elements that they knew that they were going to have, we were able to take those, put it into the dashboard, and stand that up within a matter of days. And so now every day the data can reload, and the team can see, in very near real time, who's enrolling, how well are they doing towards their goal, so that they can really try and fine tune it as best as possible.
Slide title: Collaborating with other agencies to increase impact. Corey Hart, PhD, Technical Integration Manager at the Air Force Research Laboratory, speaks into the camera.
We didn't have a good understanding of the true magnitude of the pandemic within our workforce personnel. And this really came out of the Department of the Air Force Surgeon General Office from Lieutenant General Dorothy Hogg, who had heard about the NIH Serosurvey and suggested that we form a partnership. At that point in time, we contacted Dr. Memoli, and we discussed the possibility of us doing our study in conjunction with their study so that we could better generalize results from our cohort to the larger population in the United States that they would be surveying in their study.
Slide title: Powering Research with Translational Science. Christopher P. Austin, MD, Director of NCATS, speaks into the camera.
The Serosurvey exemplifies perfectly translational science principles at a scientific level and an operational level. What was required was to take a remarkably important fundamental discovery and figure out how quickly we could turn that discovery, that diagnostic test, into a platform that could be used in thousands or tens of thousands or even hundreds of thousands of people.
Slide title: Supporting Communities.
As a person and as a physician, what excites me the most about this project is the profound impact it can have on people in our communities, in the health of our communities, and not only from the standpoint of developing new treatments and new vaccines, but also from how our communities should reopen safely. Knowing the number of people who have been infected is enormously important to all those things, and this project will move that forward.
Logo for NCATS. Website: ncats.nih.gov.